Well, first and foremost, Ms. Malango, would like you to tell us more about this appeal.
Well, first of all, Sandra, thank you very much, and thank you for the opportunity for us to join your program. Three key things for me to start off with. The first one is, as you've rightly said, this is a global pandemic, and as such, the UN Secretary General has asked UN teams around the world to help the governments respond not just to the pandemic, but also to the implications that the pandemic has on the most vulnerable of its society. In that line, we have been working for the past couple of weeks with several NGOs, Uganda Red Cross, and with the government to see what does that translate to in Uganda. So out of Uganda's 40 to 42 million inhabitants, we're looking at about 15 million people are considered to be in need, and we will be focusing on 12.8 of those who are most in need. We also had a look at what are some of the key areas where people might need assistance. Those key areas include health, and on health, I have to emphasize, it's not just a response to COVID, but the fact that people still need to have access to healthcare, whether you have HIV, TB, prenatal care. How do we make sure people maintain the access? Then we have food security, livelihoods and nutrition. We have life-saving and social protection. We have refugees, displaced people, immediate economic impact, and digital innovation. So the idea is, how can we help the most vulnerable across the most affected districts across the country? And that is the plan that we will be launching on Thursday.
You talk of food security. Would also like to hear from you on how we can ensure that we safeguard our people in this time, especially in regards to food security.
I believe that when you look at food insecurity, one of the things that has come out very clearly is that you cannot look at it in isolation. You have to look at food insecurity, you have to look at nutrition, and you have to look at livelihoods. So we see there's three critical things that have to be done from that standpoint. One is definitely to mobilize resources to be able to support the distribution of food to the most vulnerable. Within this includes people living in highly food insecure areas, such as Karamoja, some of the urban poor. It includes refugees, but it also includes some of the people who might be displaced by natural disasters as they come on board. The second thing within food insecurity that's absolutely critical is, how do you help mitigate the impact of food insecurity? Because people are supposed to stay at home and be safe. And one of the lessons we have learned from our colleagues in other countries affected by COVID is the need to have food banks. So we need to start establishing food banks at the community level, regional level, and a national level to make sure the food can be made available when needed to those who need it the most. The other thing that's very important to look at is to make sure that as a result of the lockdown, the food prices in the markets are not negatively affected. So we have to make sure that we are supporting that in that regard. And then last but not least is nutrition. What are our children eating? What are lactating mothers eating? So how do you make sure that you have the best possible nutrition during a time of a lockdown?
Right. And also let us talk about the other solutions of the agencies that you lead here that they're working on to help the country during this situation.
Right. I think that one of the things that's very innovative about what we're doing in this appeal, this is an appeal being launched by the UN, but it includes national NGOs, international NGOs, and the Uganda Red Cross. And we're particularly focusing on that because that's the only way to make sure we reach to people at the community level. So if you allow me, let me just highlight a few of the organizations who will be working with us in this appeal. The African Youth Initiative Network, the Danish Refugee Council, Farm Radio International, Smart Youth Initiative, Tunaweza Foundation, Uganda Red Cross, Uganda Women's Network, the Youth Sustainable Development Goals Fellowship, and the International Federation of Women Lawyers. So we're tapping into every possible network that there is so they can help us to target those who need the support the most, and they can also help us to figure out what is the best way to make sure their needs are met. We cannot do business as usual anymore. We may have to use technology in some of these cases, we may have to use cash assistance for some of these cases, but we have to work differently if we have to keep people alive while the people working on health try to find a solution.
Thank you so much, Ms. Malango, for joining us on NTV at